Hi, I'm talking today to Dr. Tariq Ahmad. Dr. Ahmad is a UK reconstructive and plastic surgeon. Hi, Dr. Ahmad. Thank you for talking to me today on Askimo TV.
Hi, very delighted to talk to you.
Wonderful. Dr. Ahmad, we're going to be having a discussion today about reconstructive surgery and some frequently asked questions that people may have. So let's begin with, what is reconstructive surgery?
Well, plastic and reconstructive surgery. Plastic is from the Greek plastikos, which means to refashion, to remold and reconstruct. So because people don't understand that, we often call ourselves plastic and reconstructive surgery, the same thing. Surgery often likes to take things out like cancer and so on, but we like to put things back together. That's the main thing. So we reconstruct, put things back together.
And what procedures are considered reconstructive surgery?
Well, there are certain things that you might be born with, congenital defects such as cleft lip or hair lip and palate, congenital hand problems, genital defects, birthmarks, things of that nature that we can help to correct or restore. There's trauma. We're famous for dealing with burns as plastic and reconstructive surgeons, but also do obviously head and neck injuries, hand injuries, leg injuries. And finally, of course, the main part of our work is cancer. Again, head and neck cancer, but reconstruction after breast cancer, any part of the body. We're really good at filling in holes.
What is the difference, though, between cosmetic and reconstructive surgery?
Well, cosmetic or aesthetic surgery is that for appearance. In fact, again, it's historical. The cosmeticians of ancient Rome were people who were paid to paint and decorate statues in the forum. Cosmetic and reconstructive is interrelated. All cosmetic surgery procedures are really derived from reconstructive procedures. For example, when people have facial palsy, we have derived operations to restore that, and that's what has led to facelifts and so on. Obviously, with breast cancer, we do reconstruction there, and those procedures can be translated into the cosmetic sphere.
What techniques do you use when performing reconstructive surgery?
Well, we learn a host of techniques that basically we refashion what is available from where it may be spare, so it can be used where there is tissue deficiency. We borrow from Peter to pay Paul, but only when Peter can afford it, because we want to minimize any secondary defect. But broadly, there's two categories. There's grafts and there's tissue flats. Grafts may be skin or composite tissues, and flats may be local or even microsurgical transplant, just like a kidney or a heart transplant, but with much smaller blood vessels. We have a reconstructive ladder going from simple to complex, and we have to choose the best and most appropriate technique to resolve any particular problem.
What benefits does reconstructive surgery provide, and who is a good candidate for reconstructive surgery?
Well, again, we aim to put things back the way they were, or as close as possible to this, but not just for structure and appearance, but also function. So nerves and muscles are important considerations, and new techniques are being developed all the time. But anyone is a candidate. You just have to consider the problem and select the most appropriate and the most elegant procedure from our reconstructive ladder. And again, only as long as Peter can afford it. That's to say, it must minimize any secondary problems from the tissue that you have taken to replace the tissue that's lost.
So what about any risks or possible complications?
Well, any surgical procedure has possible problems, and you minimize this by really good preparation with a thorough and detailed assessment of the problem. You discuss the nature of the problem with the patient, and then together you come to a decision about the best choices. The risks of complications are similar for any surgical specialty, but you do need detailed, informed counseling and consent with that patient. We tend to use natural tissues, your own tissues, although new implants are being developed and are improving all the time. So we don't have any fear of rejection, but they may be concerned with the take of any tissue graft, healing, infection, scarring, and all that needs to be discussed.
And what about scarring within reconstructive surgery? Is there any visible scarring?
Well, there is a misconception that plastic surgeons magically remove scars. We're just very good at disguising them or making them inconspicuous. At this juncture, scars are permanent and can't be removed, although there's lots of work going on, and in the future, who knows, we're trying to achieve scarless healing. But at the present time, we can't do that. But what we can do is make scars not go away, but become much less conspicuous.
And just a final question, what is a typical recovery time for a reconstructive surgery?
Well, it's difficult to give a broad answer to that because the remit of plastic surgery is so vast. Some operations are half an hour, some take 6 or 12 hours. So recovery is going to be dependent on the severity of the surgery, but simple healing can take a few days. Larger procedures might take a few weeks. The tissues carry on healing for a year or more, but most of the final results should be apparent, and you have a good idea of where you're going to be in the long term by perhaps 3 to 6 weeks.
Thank you, Dr. Ahmad. Thank you so much for talking to me today.
Pleasure.